Art therapy is a way to allow people of all ages, all populations, to express themselves, to learn about themselves, to basically explore through using art mediums of various types. And it is a way to encourage creativity, exploration, and build self-esteem.
We have children that aren't able to express in words what's going on with them, and feelings about trauma or feelings about ways to describe how they feel, but sometimes through the arts, through drawing, painting, drama, role play, music, those kinds of ways of expression are just more accessible to them to be able to express how they feel.
Art therapy has been shown in the medical setting to decrease symptoms of distress and also just improve general quality of life. And I believe, those are truly the studies that show why it's important that we're here.
When Emily first came to our room and was telling us about art therapy, I just wasn't sure that Eleanor was ready for it, but I thought it was an amazing resource that the hospital offered, and so I was certainly willing to give it a try. After the first time when she put her finger in a cup of paint, I realized how much fun it's going to be, no matter if she really knows what she's doing or not.
Art therapy kind of taught me that it's good to let your emotions out instead of holding them in. I don't know, I just feel like it makes you a better person.
I think that the emotional value that art therapy played was in a large part as a distraction from some of the more serious thoughts that you can have in your head, and not knowing how much time you might have left with your child, but to be able to have those wonderful experiences that you want every parent to have with their child, and all the experiences that you want the child to have in their life. And so it was really emotional. It was a wonderful distraction, and I just felt it was something I wanted for Eleanor, and I was glad that us being in the hospital for 5 months didn't prevent her from having that experience.
There's also expression through making a picture, where a small child who can't articulate what's actually going on might draw a picture that would help a therapist understand what they're going through, or what might have happened at home, where they could start to piece together the history or a family message or something that would be helpful to direct the care for that child, or to help the child with coping skills during an illness or a trauma or a burn patient, things that might be more focused on what was wrong with them, with that individual patient.
So when a patient comes into the hospital, we have to ask them to change into a hospital gown, get into a strange bed they don't know, be separated from their family, separated from their friends, asked to do things that they don't want to do that hurt in order to make them better. So they really lose control over their environment, and in many cases over their body. And so it's great with art therapy because it does give them the power to be in control again. Our program right now is currently funded through the Children's Hospital Foundation through donations.
In order to provide art therapy at Coastal Children's Hospital, funding is what is most important. So the funding allows us to buy the supplies, allows me to give the children choices about what materials they can use.
And the more avenues I think we can offer for children to express themselves, the more accurate we will be at understanding their situation.
There's constantly more activities we could be doing, and I'm looking forward to those days when we can do that.